Sunday the 29th of March, we're going to think about a few more countries now. Welcome back. Now, South Korea. A large part of the success in South Korea has been the testing, the isolation of infected people and the quarantining of the contacts. That's why the numbers aren't going up. But what they're getting a lot of in South Korea is backflow, cases coming from overseas. So I saw a video this morning and they're testing at the borders and airports and things, and they can get a test back in minutes. It's quite amazing, the testing technology in South Korea. So let's hope they share this technology with the world and the world can do such efficient testing. And anyone going into the country, they're completely following them up. Fines or deportations that people that don't obey the rules. This is kind of an appeal to the world, really. Whoever knows how to make these tests, can they please share it with everyone in the whole wide world so all the biotechnology countries in every country can make lots and lots of safe, reliable tests. We're absolutely desperate for these. Now, the United Kingdom, the numbers are going up. That's the total number of confirmed cases. But we are testing a bit more. Not as much as I would like, but we are testing a bit more. Number of deaths in the UK is increasing. Now, we do really expect this because the lockdown is going to take time to work through. And as we looked at in the last video, there's a lag time. And there's an even longer lag time, probably 3 weeks in the deaths. So we can expect the number of deaths to double every 3 days for the next few days in the UK. And this is true for other places probably where the lockdown is just being instigated. If it hadn't been for the lockdown, this would just carry on. So the lockdown's coming. This should peak, hopefully in my country, in about a couple of weeks. But we have to be braced for more bad news in the short term while we wait for the effects of the lockdown to work through the incubation period of the illness. So no real doubt there's going to be an increase in deaths over the next days. Now, the scientific officer yesterday was saying that 20,000 deaths is really a best case scenario for the UK. So if we get away with 20,000 deaths, that will be as good as we can hope for, probably, in my country. A few days into the lockdown now. Drive-through testing for healthcare staff, which is encouraging. They've started this hospital called the Nightingale. They've converted this huge centre in London. I think it can be 1,000 beds or something. So glad to see that's happening, and that's happening in various other places in the country. So the infrastructure is being put in place. Now, I must say I'm impressed. I am impressed that the logistical people in my country have got their act together and are building these temporary hospitals. We did compliment the Chinese for the rate at which they built new hospitals, but we're essentially doing the same thing. We're just converting existing buildings and turning them into temporary hospitals. And appropriate that this one should be called after Florence. So very encouraging there. The question in my mind is who's going to staff them. Now, I haven't got a peer-reviewed journal on this yet, but the patients that are in critical care, in intensive care in London, mostly they're over the age of 50. Not entirely. I do know of other younger cases, younger than 50, tragically younger than 50, but most are over 50. And there's more, according to the news report. I haven't got the figures yet. Although we did look at some figures earlier on from the Intensive Care Society reports, but this report's saying more than twice as many men as women. So the severe form of this, the most severe form that require critical care, and presumably that's going to work through into deaths, is men are more at risk than women. I have no idea why. In China, we had thought it was due to more men smoking. Certainly in my country, men, I'm saying certainly, I think men drink more than women, but women do quite well for drinking in my country as well. So I really don't know why this is. I get the feeling there could be some really important biological information to come out of this observation that men are getting more serious disease than women, but at the moment I don't know what it is. Now, hydroxychloroquine, this old-fashioned anti-malarial drug. Now, a lot of places have chloroquine resistance for malaria now, but chloroquine was used for malaria for many, many years. And this is starting a community-based trial. Now, in the past, the chloroquine was used for people that were already really quite poorly in hospitals. But this is a community-based trial, so the chloroquine is going to be trialled, I assume against a placebo, in people at an early stage of the infection while still at home. And the theory is that this will prevent viral adsorption, therefore it will limit viral replication, and also have some anti-inflammatory effect. Now, I really hope this is true. So what they're saying is that the cells which can become infected with this virus are these cells lining the respiratory epithelium, these cells here. And the virus will only get into the cells through specific sites on the surface of the cell, these sites that the virus will bind to. So the virus will come along, and to get into a cell it has to bind to these receptor sites before that facilitates the entry of the virus into the cell. These are called the ACE2 receptor site that you might remember from earlier videos. And the virus can only reproduce in the cell. So once a virus gets into the cell, it'll produce, I don't know, hundreds of copies of itself. And these will then bud out from the surface of the cell. And of course, this cell here is facing the inside of the bronchial passages, the airways. So if these are the airways, the smaller airways in the lungs like this, then these cells here are lining these smaller airways like that. So that means when the viruses are produced, they're going to come out and they can be coughed out and infect other people. So that's the way the virus gets into the cell. That's the way the virus reproduces. So if you can block that and stop the virus getting into the cell, then you're going to limit viral replication because the virus can only replicate inside cells. Viruses are what we call obligate intracellular parasites. They can only reproduce inside cells. So if you can prevent the viral absorption, the hope is this, that hydroxychloroquine will prevent the virus absorption, therefore limit replication. Therefore, the person won't be as sick. And also, I would imagine that would mean they're not as infectious because they'd be shedding less virus into their respiratory tree. So very promising. And there's also talk of anti-inflammatory effects there. Now, I know anti-inflammatory effects are complicated. There's been many people advocating not using some non-steroidal anti-inflammatory drugs such as ibuprofen, because sometimes we want the anti-inflammatory effect, but sometimes later on in the illness especially we don't want the anti-inflammatory effect. So it's quite complicated because the inflammation is probably part of the reason why these small airways and these small air sacs, the alveoli, can fill up with inflammatory fluid. And as these fill up with fluid, as we've seen before, that stops the oxygen getting out and it stops the carbon dioxide getting in. So sometimes the anti-inflammatory effect is good, and the hope that the anti-inflammatory effect brought about by the hydroxychloroquine is going to be a beneficial anti-inflammatory effect rather than a potential deleterious anti-inflammatory effect, as may be going on with the ibuprofen. So promising there, and community-based trials. So this is going to be given to people at home. And if this works, it'd just be brilliant because chloroquine's cheap, and as far as I know, the manufacturers can make it in very large amounts very easily. So let's hope that trial shows some therapeutic effectiveness. But it's right to do the trial because, as the World Health Organization said, we have to be guided by the evidence. Now, the United States case is greatly increasing. The president was talking about quarantining New York and New Jersey and somewhere else. But I think that's been reduced to a strong travel advisory now. Slightly concerning that a lot of people from New York seem to be going to Florida, potentially spreading the disease to Florida, of course. Now, I did notice, I don't want to criticise any world leader because my leaders have been the same, but President Trump was signing some act into power, and all his big wigs were just roundabout standing like that next to each other. And people were doing the same in my parliament just a few days, just a week ago anyway, where they were actually crowding together having conversations in parliament as if we weren't in the middle of a life-threatening pandemic. Leaders need to adapt their behaviour so they can lead by example. As I say, I'm not criticising any leader. It's not a political comment. People all around the world have been doing it. Let's learn from the mistakes and let's move forward separately while we are metaphorically together. This was quite concerning. New York Police Department, 500 officers tested positive. That was very concerning. Whether these officers contracted the disease in the line of duty or off duty, we have no way of telling because there's a lot of disease in New York anyway. But concerning that NYPD is starting to be affected there. Now, people are always asking me to include more countries, and you can only. The point of this is just to give us an idea, a feel of what's going on, so you can interpret your local news hopefully more accurately. But Denmark increasing cases, all education and all shops shut, police patrols to enforce it. No meetings are over 10 people. That's too many. Denmark needs to reduce the number of people that are allowed to meet. In a meeting of 10 people, one person can infect 9. Not good enough in my view. Canada, again, significant increase, 819 cases in the past 24 hours. Mr. Trudeau is saying that distancing is making a difference, and that's reasonable that it is. Quebec's a bit of an epicentre, but all provinces are affected in Canada. Now, I've just got an email from Peru here. Now, the numbers of cases are low in Peru, and this person who's emailed me from Peru is delighted at how proactive the Peruvian government seems to have been. So some encouragement here, because most governments in Europe and the United States have been grossly, in my view, reactive, waiting till the problem was obvious rather than anticipating the problem. But in Peru, they declared a state of emergency on the 14th of March. That's now extended to the 12th of April. Army are on the streets, curfew, no schools, no gatherings, no restaurants, no pubs, no private cars. Public transport reduced to the minimum. People can only go shopping by taxi. Taxis are a bit of an enclosed space. I'm not sure I like that one. Potential spread in taxis there. I would have thought you're better walking in the fresh air. They can go on foot or on bike. Okay, that's good. They can go on foot or on bikes, which is fine. Obviously only to buy food or medicine. It seems that the country has been following. It's the only country that's been following all your recommendations. Well, me and the World Health Organization, I guess, and everyone else who's been informed on this. But good to see this proactivity in Peru. Let's really hope it pays off for them. It's a unique case in the region and maybe can be a good example to the world of the sacrifices that have to be made now in order to don't have a real tragedy in a few months. So let's hope that proactivity in Peru is effective. Now, just a video and a few pictures to close. This was in Japan. If we have the technology, yeah. So good to see the spacing there in Japan. But yet, I've been told these pictures were taken in the last few days in Japan, so this is a bit concerning. Now, having said that, the number of cases in Japan doesn't seem to be huge because I believe they have extensive testing. But I must say, I'm not really sure what's going on in Japan. To take those pictures at face value, they seem to be somewhat concerning. And I'm just going to close with a video report now from Sweden. But just before we do that, let's just notice that cases are increasing. It is going to get worse. It looks like Italy might be reaching the peak now. Places that have been more recently locked down, we can unfortunately expect cases and deaths to carry on increasing, but we can expect that to start working and paying dividends. But there will be a lag of 3 weeks or so before we start seeing serious benefit, but it will start working. So again, I appeal to everyone to obey the authorities, to stay at home unless it's absolutely necessary, pretty well wherever in the world you are. And we also are waiting for massive scale testing. Let's hope the testing is massively ramped up so we can isolate every case, quarantine every contact, and then start lifting this rather crude instrument we have just now, which is the mass lockdown. And hopefully that will keep us going, albeit with a reduced level of activity, and it must be admitted a changed lifestyle for some time to come.
Hello, my name is Adrian and I'm from Sweden. I'm a medical student. I used to be a physio. I want to give you some update about what's going on in Sweden. I'm trying to stick to official information from the government, from press conferences that are not run during the weekend. So this is information from Friday the 27th of March and some data from Saturday the 28th of March. Okay, cases, deaths and ICUs. We have 3,447 confirmed cases as of Saturday, 102 deaths as of Saturday, mostly aged 70 or 80 or above, 239 COVID-19 ICU patients in total so far. And we have about 500 ICU beds in Sweden and about 30 more being built specifically for COVID-19 patients in Stockholm in a military hospital. The curve seems to slowly be going up. It is now forbidden for gatherings over 50 people. It used to be 500. There are some recommendations. Stay at home if you're sick. Stay at home 2 more days to make sure that you're healthy. Think before you travel. Think seriously before you travel, especially since Easter is coming up. Work at home if possible. Restaurants and bars are only allowed to keep guests seated at tables and not standing at bars, but they're still open. They and others can receive risk assessment support from the government. There are specific recommendations to the elderly and the vulnerable to adhere to these restrictions more strictly than if you're younger or more healthy. The strategy is to keep as much of society going while protecting the elderly and the vulnerable, but there is no mass testing. The government is absolutely recommending social distancing and have done for some time, but they're not enforcing it. They're also recommending quarantine if you're sick, but it's not enforced. If you're in school and you're 16 years or older, or if you go to university, the education is run over the internet. If you're younger than 16 and if you're in preschool, it's still open and running as usual. The government is considering closing down Stockholm, but it doesn't seem to be happening anytime soon. They're also considering closing down preschools and keeping them open for parents, for the kids who have parents working in healthcare, electricity, sanitation, education, and so on. The official line on health care safety equipment since the 27th of March is that you should wear a short-sleeved plastic apron, gloves, and a plastic visor, but no mask. If you're working where there's a risk of aerosol spreading, then you can use a fully covering equipment, including a mask. The ski resorts are still open. They're not recommended to run after skis. Some of them have closed it. Plenty of people are still traveling. So the recommendations, a big proportion of the population following them, but a big proportion is ignoring them. My observations and other people's observations is that there are less people going about, but there's still plenty of activity going on. Some portion of the older population seems to be ignoring the recommendations. The government seems very sure that they know what they're doing, and the international press and experts internationally seems to ask the question if we're running an experiment here. How that is, I can't tell. That's all. Thank you.